2017. It's my honor to stand here at the 5th Conference of Surgery in Palestine to present our study entitled The Breast Reconstruction in the Gaza Strip, Awareness and Influencing Factors. This study was done by dispatch of 5th and final year medical students under the guided supervision of Dr. Bettina Butcher and Dr. Khamis. During my talk, I talk about background and why breast reconstruction, objectives, methods, results, conclusion, recommendations, limitations, acknowledgement, and finally the references. Why breast reconstruction? All of us know that mastectomy could be a definitive treatment for local control of breast cancer. Yet, the resulting disfigurement effect could be horrible for some women. Also, mastectomy is well known in Gaza, yet breast reconstruction is not. The objects were to determine the extent of culture and awareness of a breast reconstruction among the female patients underwent mastectomy. Also, to identify the influencing factor to have breast reconstruction, as well as justification for not to have a breast reconstruction. Regarding the methods, it was a cross-sectional study taking a total sample of 173 female patients from August 2015 to April 2016 at Ashifa Hospital and later on Al-Tiso Hospital and the Reben Gaza Hospital. Our inclusion criteria was being a female aged from 25 to 75 years, being married, oriented, coherent, and able to give a consent. And the mastectomy should be done for at least 6 months before the interview. A self-designed questionnaire was judged by a panel of surgeons, oncologists, and psychiatrists, filled by a face-to-face interview. The questionnaire used 5-point Likert scale. It consists of socio-demographic data, awareness level of breast reconstruction, possible positive effect to undergo breast reconstruction, justification for not to have breast reconstruction, and finally, the cause effect and breast reconstruction decision. A total number of 190 who met the criteria were asked to be interviewed. 17 refused. Of the remaining 173 who was accepted to be interviewed, 12 refused to fulfill the breast reconstruction domain. Regarding the results, a third were below 46 years and another third were above 57 years. 72% had a low educational level, below the secondary education. 23% had metastasis at the first time of presentation. As I have said, 100% underwent mastectomy. In addition to that, 56% underwent chemotherapy and radiotherapy, and another 38% underwent chemotherapy beside the surgery. Regarding the type of the surgery, the vast majority underwent modified radical mastectomy, and only 17% underwent breast-conserving surgeries. What about the female concern about the overall look? 55.5 were concerned about the overall look, evident by the use of ball in the brow for some times after mastectomy. Regarding the awareness level of breast reconstruction among the female patients, 42% were not aware at all about the breast reconstruction, even the concept. Of the remaining, 3/4 of them are aware from social media and or other means, and only 25% are aware from the treating doctor, meaning the surgeon. When we studied the causes to undergo breast reconstruction, we have 4 main reasons. 48% wanted to undergo breast reconstruction to gain positive attitude from others. 72% wanted to have breast reconstruction to satisfy the husband horn. 23% wanted to have breast reconstruction to regain self-confidence. Surprisingly, 73% claimed that mastectomy did not affect her self-confidence. 20% wanted to have mastectomy to wear the preferred clothes. On the other hand, when we study justification for not having breast reconstruction, 29% claim that they are not concerned about the physical appearance after mastectomy. 22% are afraid from the complication of the surgery itself. And finally, 11% were worried about getting unsatisfactory results. We studied the difference in breast reconstruction decision and the cost effect. 86% refused to undergo breast reconstruction in a private, but when you offered them if health insurance expanded to cover breast reconstruction, will you undergo breast reconstruction? Shockingly, 65 refused. As a conclusion, our female patients seems to be motivated by the socio-cultural beauty show and the influence of the relationship with their husband rather than other causes. And our recommendations are to expand the culture and awareness of breast reconstruction more, to offer better communication between the healthcare professionals and the patients, and to elect breast reconstruction as an option, which needs to expand the health insurance to cover breast reconstruction, also involving the patient's family inheritance and support. Finally, conducting a media campaign to emphasize the possible physical, social, psychological benefits of breast reconstruction. Regarding the limitations, the biggest was unavailability of an appropriate data collection sheet, which forced us to create our own and to be judged by a panel of surgeons, oncologists, and psychiatrists. And from this place, I'd like to thank them all. That's all I have about breast reconstruction and the our closing. Thank you.
Thank you.